Good morning all. Today I am going to teach you regarding the gynecological diagnostic measures and procedures. So first one, cervical and vaginal smear for exfoliative cytology. So the indications are as a screening procedure, then for cytohormonal study, and for other purposes we will collect the cervical and vaginal smear. So first one, screening procedure, collection of material. So in collection of smear, in picture A you can see using Area's spatula from the squamo-columnar junction for screening. In picture B, by cytobrush taking endocervical sampling for screening. And in picture C, by wooden spatula from the lateral vaginal fornix for cytohormonal studies. So this is the three ways we are collecting the material for screening procedure. So for vaginal pool aspiration, we will use the Rochet endocervical brush. This is a picture. Then next we will see women subjected to cervical cancer screening program. So first one is low risk. Women who had never been sexually active. Woman aged 70 who had 3 negative smears in past 10 days. Women who had hysterectomy for benign lesions. So for them, screening schedule is nil. Then who is at risk? Woman aged 21 years or having sex for last 3 years up to the age of 70 who are or have been sexually active. So for them, every 2 to 3 years after age 30 and with 3 negative yearly smears. Then for high risk, that is early marriage people, early intercourse, early pregnancy, smoking habits, oral pill users, multiple sexual partners, human papilloma virus infections, then women who are immunosuppressed, that is HIV positive. For them, every 2 to 3 years after age 30 with 3 negative yearly smears should be taken. So for morphological abnormalities of the neurons, nucleus, that is liquid based cytology in first picture. Normal squamous cells and endocervical cells will look like this. Then figure 2, that is severe dyskaryosis. Then reporting system. Papa-Nicolas grading. Group 1 normal. Group 2 presence of borderline atypical cells probably due to infection, no evidence of malignancy. Group 3 cells suspicious of malignancy. Group 4 presence of few malignant cells. Group 5 presence of large number of malignant cells. This is carcinoma cells. Then accuracy. The Bethesda classification system for cytology, that is adequacy of sample satisfactory or unsatisfactory. So squamous cell abnormalities, atypical squamous cells of undetermined significance. Then cannot exclude high-grade lesions, low-grade squamous intraepithelial lesions, high-grade squamous intraepithelial lesions, squamous cell carcinoma. In glandular cell abnormalities, atypical glandular cells specify site of origin if possible. Atypical glandular cells favor neoplastic adenocarcinoma inside and adenocarcinomas and other cancers like lymphoma, metastasis and sarcoma. Then inferences, that is maturation index from birth to menopause. At birth, smear features are combined effect of circulating maternal hormones, estrogen, progesterone and corticosteroids. In childhood, that is MI shifting to left because of diminished steroid hormones. Then reproductive period, that is pre-ovulatory, smear cells and cells are discrete, estrogen present. Then mild secretory, that is smear is dirty and cells in clusters, inference is estrogen present, progesterone present. Then during pregnancy, that is marked folding of the intermediate cells, navicular cells. Then postpartum and postmenopause. Then Fern test, that is typical Fern pattern appearance of the cervical mucus. Then colposcopy. This is the colposcopy. It is a technique of colposcopy, needs ease of maneuver, that is frontal distance of 225 to 250 mm magnification 6 to 16 times, adequate light source 30,000 lux, and the stand to permit the mobility and the examination table for patient discomfort. Abnormal cytology and place of colposcopy. Cervical cytology, that is squamous cells. Procedures HPV, HR types, repeat PAP in 6 months. Then colposcopies, colposcopy, ASC, LSIL, HSIL. So all the things in glandular lesions also colposcopy can be done. Then colposcopy terminology. Normal colposcopic findings means A means normal squamous epithelium, B means columnar epithelium, C transformation zone. In second, that is abnormal colposcopic findings. A means atypical transformation zone, mosaic, punctuations, acetovite epithelium, keratosis, atypical vessels, iodine deficiency, suspected frank invasive cancer. The cancer is evident only colposcopically. Then in unsatisfactory, that is transformation zone not seen. In other findings, condyloma, ectopy and papilloma are of importance. Then computer tomography, that is CT scan. CT scan of the pelvis showing an ovarian mass. Coldocentesis, that is endometrial sampler we are taking. Then coldocentesis means site of the entry of needle. Needle we will insert and we will do the procedure. Then some of the gynecological endoscopic procedures: laparoscopy, hysteroscopy, salpingoscopy, falloposcopy, cystoscopy, coldoscopy, sigmoidoscopy and proctoscopy. Then in laparoscopy, this is a chlamydial infection causing perihepatic adhesions. So this picture is showing the laparoscopic view of a normal pelvic showing uterus, tubes, ovaries, round ligaments, uterosacral ligaments and the pouch of Douglas. Laparoscopic instruments, that is telescope, trocar and cannula and Veress needles. Ancillary instruments, scissors, bowel grasper, myoma screw, bipolar coagulating forceps, grasping forceps, grasper, dissecting and grasping forceps. So this is a picture showing the laparoscopic linear salpingostomy for unruptured tubal ectopic pregnancy. Linear incision on the anti-mesenteric border gestation sac is removed and incision margins left unsutured. This picture is showing the portal of entry, that is of the laparoscope. Primary port, umbilical port, B1 and B2. Accessory ports are lateral ports on one each side, that is 3 to 4 cm medial to anterior superior iliac spine but lateral to inferior epigastric artery. And C is Palmer sign and D is suprapubic port. Visualization. Diagnostic procedures may be performed with the direct optical visualization. Operative procedures are carried out with the video camera. See, this picture shows laparoscopic view showing the tubal sterilization with Silastic Fallop rings and laparoscopic myomectomy. Myoma screw is used for traction of the myoma. This picture shows the panoramic view of the uterine cavity with a hysteroscope. Tubal ostium is seen, one on each side. This picture shows hysteroscope and hysteroscope with working element for operative interventions. This picture shows the resectoscope with an angled cutting loop. So this is a picture, that is hysteroscopic procedures in progress. So this picture shows the hysteroscopic view of the submucous fibroid. This figure shows the patient with a complete septum. Resection of the septum is being done using the resectoscope. And the next one is cervical biopsy pictures. First picture shows the cone biopsy. Second picture, that is procedure for thermal cauterization. So this is regarding the gynecological diagnostic measures and procedures. So hope you understood. Thank you.